The time to pursue surgery as an option is when a person has exhausted the other measures that are more conservative, the non-surgical options, or if they, for whatever reason, do not want to try the other options. For stress incontinence, there are two basic types of surgical procedures. The first is a urethral bulking procedure. This involves injection of a bulking agent in the urethra to increase the resistance when someone is voiding, thereby reducing the number of incontinence episodes. There's another option known as a sling surgery. This involves placing a small piece of mesh under the individual's urethra to support it, and again, to allow the urethra to kink off and prevent leakage when the person coughs, sneezes, laughs, or does physical activity. There are surgical options for urge incontinence and also for overactive bladder, which urge incontinence is one symptom of. The surgical options include injection of botulinum toxin in the bladder. This quiets the signaling from the bladder nerves to the bladder muscle and makes it less active. There's another surgery called sacral neuromodulation, where a small device with leads going to the sacral nerves are placed to influence the way that the bladder nerves communicate with the bladder muscle. The goals for a surgical treatment of incontinence, whether that be stress incontinence or urge incontinence, is improvement in a person's quality of life. So that may be measured by decreased number of incontinence episodes, ability to hold one's urine longer so that they can go out and enjoy an activity that they weren't able to enjoy before, or sleeping through the night without leakage of urine. The surgeries for both stress incontinence and urge incontinence are minimally invasive, requiring no incisions or small incisions. They usually leave the hospital on the same day. For some of the surgeries, one can be back to their regular activities the very next day. Others require limiting heavy lifting and exercise for several weeks. Holy Cross Health has a comprehensive pelvic floor center where we use multidisciplinary specialists such as urologists, gynecologists, colorectal surgeons to help patients get the right diagnosis and to pursue appropriate treatment for their conditions. For many years, Holy Cross Health has had an excellent reputation in this community for providing care to patients with pelvic floor issues. It's exciting now that Holy Cross Germantown is able to offer those same services to patients in this region.